so you should be okay. You go in, you pull up. Now, how much do you use? Let's see, some say on the pad. The bigger the pad, the more you need. Usually I take 2 cc's or 2 milliliters. Milliliters is the same thing as a cc. Let's just say the bigger the pad, the more you need. You need enough to cover the entire pad. You remember with all the other modalities, the bigger the pad, the less current density. If you have a pad that has only one spot touching the skin, that's where it's very dense. Okay, so this is your electrical pad with the medicines going in. So you need to soak the entire pad. If an area stays dry, no electricity can go through that. That is an area that doesn't get treatment. 1, that's a bad thing for your protocol. 2, the pads are more dense because there's no electricity coming through that area. Greater chance of burns. So you take your dexamethasone and you fill up the entire pad. So usually with a large pad, 2.0 works well. Obviously don't soak it so much when you put it on them it's dripping all over the place. Okay, so the active pad is the one with a cotton base. That's your medication. The dispersive is the big one that is long. Dexamethasone is a negative medicine. What do I put on the active pad, black or white? Black. So black is active. This is like a battery cable. It has a little squeeze thing on it. So you squeeze it, you put it on, and you let it go. And it doesn't come off. The red goes on the dispersive. Squeeze it, stick it on there, let it go. It shouldn't come off. So you're going to walk up to your patient, you've cleaned their skin, you've inspected it, you checked the sensation, you asked the indications, you asked for the contraindications. Put the pad on the area. Needs to be treated. Make sure you know where you're touching lateral epicondyle. You're putting the active cotton pad right on the condyle. You put the dispersive 4 to 6 inches away on the same side of the body.
So the active is going to be on the...
Yes, because you have, for dexamethasone, we have inflammation condition. I have lateral epicondylitis. Dexamethasone is an anti-inflammatory. I'm pushing an anti-inflammatory in an inflamed tendon. Make sense? Okay, so my machine is on. My lead is plugged in. My dosage is set at 40. You'll get that on your piece of paper. I'm going to put this on program. I set it at 2.0. When I am ready to go, I flip the little top thing here to run. The machine starts itself. You can see here that it is raising up
It takes a little while with these machines.
to 2.0. This burns. I don't like it. So I'm going to turn this down a little bit because it's burning. When the machine is at full current, where you set it, you'll see the dose, and then you can work up to 40. Or you can watch the time. To watch another time, you hit that round button, so you see time show. All right, you're going to be in for 25 minutes. If you don't feel it anymore, you don't feel anything, let me know, I'll turn it up, because some people get to be used to it. But if it's too strong, or they feel any burning sensation, you got to turn it down. If I want to turn it down, I hit the round button, so I can watch it be turned down. Okay, so if I don't feel it anymore, I can turn it up. And I can watch the time, 22 minutes.
So the time adjusts as you adjust
So
the
time is
intensity.
adjusting.
Yeah.
The time is adjusting.
The time is adjusting. Why?
Because
Because I adjusted the current. Right? Because I'm messing with the current.
Okay.
See here, it's 22 minutes. And my current is 1.7. I'm saying ouch with that. So So I'm gonna turn the current down to 1.0 or 1.1. See how the time just went up to 33 minutes? Okay. It's all a relationship. So there is
It's like a
density.
seesaw. You've got one here, and one here, if you're changing them, they're going like that. They're both converged.
Okay. For this machine, for treatment, normally your treatment's done. If your patient just can't take it anymore, turn the current down as low as you can. For this machine, I'll allow you to turn it off while it's hooked to the patient because it doesn't shut off. But if you want to disconnect it before you shut it off, that's fine. Any questions?